symptoms that people should consider when they're, thinking of themselves as having PCOS?
First, thank you, Aparna, for doing this program. I think it's such a need of the hour, and thank you for asking me to be a part of this great panel. Thank you so much. So, PCOS or polycystic ovary syndrome, simply put, is a hormonal disorder of women of reproductive age. And we define reproductive age as between 15 years and 49 years, or at least 15 to 45. Having said that, it has actually impact on women throughout their life. So that's the first thing to remember. It's the most common um, endocrine problem of women of reproductive age. So it's that common. Probably somewhere around 10 to 15% of women in that of women of reproductive age. And in India alone, there are something like 330 million women between ages of 15 and 49. So that's a huge number.
Right.
As far as symptoms of PCOS, which you asked, so typically women can present with menstrual irregularities or no menstruation, what we call amenorrhea, or they present to us with clinic features of male hormone excess. Both men and women have male hormones normally, but women with PCOS have a little more of the male hormones, and therefore they may have more acne, oily skin, facial hair, body hair, hair that should not be there, and hair loss from the scalp. So typically men have balding and body hair. So the same thing kind of happens to women as well. They lose hair on their scalp and then grow hair on their face or chest or upper back or lower back. And and then the other symptom is they may have some difficulty with getting pregnant and what we call subfertility or fertility issues. So these are the usual symptoms. And then anywhere from 50 to 60% or more of the women with PCOS are overweight. So that may be another symptom that makes them come and consult a physician.
You, Dr. Sheela. Dr. Usha, can you just clarify, because I think this gets talked off whether it's PCOS, whether it's PCOD. If you can just clarify that.
Short answer, PCOS.
Right.
Because polycystic ovary syndrome, and syndrome just means a constellation of different things, and which is really what PCOS is. There's this and this and this and this, and it's a constellation. It's not one thing. Whereas the other reason why we kind of shy away from PCOD is D stands for either a disease or disorder, and as is PCOS comes with a ton of stigma and taboo, and we didn't want to add another layer of that to describing the condition. So as much as possible, I mean, we try to stick to PCOS.
Right. Okay.